the living donors were first developed for kids in the 1980s because there weren't that many brain-dead donors that were the same size as children. There was a high rate of mortality of kids that were waiting for liver transplantation, and at that time this procedure was developed as a way to offer kids an opportunity to get a piece of the liver from, say, a parent. So kind of an ideal situation where you had a willing and able healthy donor who could give a small segment of the liver to a baby. It's very small, and so the amount of liver that one would have to remove from the parent was relatively small. And that has become a very important standard approach to offering kids liver transplants. So nowadays about 30 to 40% of liver transplants in kids are done through living donors, with success rates that are over 90% at the most of the major centers, so excellent survival. In the 1990s, this procedure for kids was expanded as the technique developed further to include adults who are getting pieces of liver from organ donors, healthy donors. The problem in adults is that because the adult is a larger size, you have to remove a larger piece of the liver from the live donor. Usually in an adult to an adult transplant, we'll remove about 60% of the liver, which is the right lobe of the liver, which is a significant operation compared to giving a small piece of liver for a baby, for example. So the technical parts of it were more complicated, and also the ethics were a little bit more complicated because you're increasing the potential risk to the donor by doing a bigger operation than what you might do for a baby. And so this procedure was approached very cautiously in the mid-1990s and then slowly has developed as the experience has grown over time. So now there's more than 15 years experience in the United States, and worldwide there have been many thousands of live donor liver transplants performed. In fact, in some countries, it's the only way that liver transplants are done is through living donors because they don't have brain death laws. Japan, for example, some of the Asian countries, they may have cultural barriers to brain death, and virtually all the transplants in those countries are done from living donors in livers. So it's not an unusual or unique situation anymore.